NAC conferences are one of the very best ways to really keep in tune with what's going on, not only at the national level, but also better understand trends that are happening at the state level. And as a PCA, that's critical that we're able to stay informed so we can better educate and support our health centers back home. You know, we're one big family, and if one of us isn't doing well, none of us are doing well, and there's such strength in numbers, and we all have to pull together, particularly in this environment, and not only be members of NAC, but also be members of PCAs and be one big group, because without that, we could really get picked apart. And so we really, in this environment, it's critical for us to all support one another and keep educated and move forward. So I believe the most important conference that NAC offers that I really see a lot of value to is the NAC P&I, or the Policy and Issues Forum. It's a great opportunity for everybody to come to Washington and go and visit their members and get educated about what's happening in Congress that's going to impact our funding, it's going to impact our reimbursement back home, and it's also a great opportunity to share the great work that we're doing with federal policymakers and with one another, because we really learn so much from each other, particularly at that conference, because I think it's probably the best attended, and so you're going to hear voices from all across the country that are going to support your efforts back home. I think attending NAC conferences is always a good thing to do for the educational benefits, but I believe probably the most important aspect of attending a NAC conference are the great professional peer networking opportunities. I know when I first started at the Texas Association of Community Health Centers 18 years ago, I attended a NAC conference my very first week, and it was at that conference that I realized, you know, this is a big national movement. This is a lot bigger than what we're just doing back in Texas and what we're doing back home. And I met so many great people that are in similar situations, in similar positions, and they're so supportive and helpful. And I know that when I go back home, I always learn something at conferences, but I always meet one or two new people that are in a comparable job, and I always can call them, and I do frequently, to get ideas about how to address issues that we're facing back in Texas, or how to take advantage of opportunities. And we can certainly learn a lot from each other, because this is a very creative group and a very sharing group. I've never really had an opportunity to be with so many people that want to support one another. And there's no shortage of people that are willing to help you and are willing to reach out. And I know we feel the same way, and I always really embrace meeting new people that are new to the movement and want to support them. And the NAC conferences give us a great venue to be able to do that. There's a lot of value to being a NAC member. Not only do we need to support each other to continue to move forward so we're successful, but a lot of it is the professional peer networking. And I know, being a NAC member, you have access not only to the great staff at NAC, who are just experts in so many different areas, both in terms of policy, operations, financial management, but you also have access to other health centers and primary care associations on an ongoing basis, not only at the NAC conferences, but in conference calls, in learning teams, and in committees, where you're really able to learn not only what's going on, but really better identify solutions to resolve a lot of the problems that we're facing, or take advantage of a lot of the opportunities that are out there. So being part of NAC just taps you into this tremendous resource of people, of expertise, of consultants, of training, of technical support, of products that, you know, really make your jobs a lot easier back home.